All right. So good evening, everyone. Thank you for coming tonight for an insight into all things medicine. So I'm Jade and I'm a current final year medical student at the University of Nottingham. And what I'm going to speak about today is basically a bit about my background, why I chose to go into medicine and the realities of being at medical school. So just a little bit of background on myself. For A-levels, I did maths, biology and chemistry. I did both the UCAT and the BMAT entrance exams for medical school, and then I got offers from Nottingham, Birmingham and UCL. And then after careful deliberation, I decided that I wanted to go to Nottingham to study, and I'm currently in my final year now. And after all of these years of studying and placements and other opportunities, I've sort of narrowed down my interests currently in pediatrics, which is children's medicine and surgery as well. So for me, why medicine? When I was in your shoes deciding what to study at university, I thought that medicine really represented the perfect intersection of both my interests in science and people. So we know on one hand, medicine is a very, very scientific field. So at med school, you'll cover things like anatomy and physiology and pharmacology and lots of other topics that help you to really understand the inner workings of the human body. But on the other hand, medicine is a really deep human field. So it requires things like empathy and communication, and also a deep understanding of social factors that impact people's health as well. So as a doctor, you're not only responsible for treating the medical conditions that you see in the textbooks, but you're also responsible for guiding patients through sometimes the most challenging moments of their lives. And I think to be able to achieve this, you have to constantly learn. So whether that be from a scientific point of view, learning new facts and keeping up to date with the literature and current research, and also learning important life lessons from experiences that you have with your patients. So I really believe that there's no other job that offers you these kinds of experiences and challenges, and that's also for your own personal development as well. And I think 5 years into studying medicine, I still feel like I've made the right choice. So this image is just showing all of the lanyards I've gone through in my time at med school, and I'm finally on my final green lanyard. So it does feel really surreal getting to the end of that journey. And I'd be lying if I said that some days you don't feel like motivated to do the work because it is an intense workload. But I think going to hospital and placement and seeing your patients and having those interactions with them that are largely positive really motivate you to keep going and reinforce on a daily basis why you're doing this work. And that being said, I want to speak a little bit about the application process to med school because it is quite a lengthy one. So I've just made a brief timeline of the application process. So in around July to September is when the UCAT exam runs. So between this time frame, you choose a date when you want to sit the exam. And then October 15th is the UCAS deadline. So that's when you submit things like your personal statement, references, predicted grades, and your uni choices. And that deadline is for things like Oxbridge applications, med school, dentistry, and other things. Shortly after that is traditionally when the BMAT exam is held, and that's for med schools like Oxbridge and some of the London ones like Imperial and UCL. November to March time is usually when the med schools hold their interviews across the UK. And then by May, you would have heard back from your universities by the latest whether you were successful or not. Then do your A-levels, have a very well-deserved summer holiday, and assuming everything goes according to plan, you go to med school in September. So you guys are probably in this stage right now, just before everything's starting. We're in March at the moment, so you're probably thinking, what can I do to enrich my personal statement? What opportunities can I get involved in? And also things that help you decide whether medicine is for you or not. And I think one of the main ones is work experience. So there's no way to understand what it's like to be a doctor than to shadow one. And I'd encourage you to email or contact your local hospital and ask about work experience. and also through contacts, so friends or family members in healthcare, and asking them to signpost you to the relevant contacts to organise this work experience. And I'd recommend doing hospital work experience and if possible GP as well, because the two different healthcare settings, they operate in different ways. They also see different sorts of conditions and demographics of patients. So it would give you a more comprehensive view of the healthcare provision in the UK. Also, I would recommend shadowing multiple members of the MDT. So that's the multidisciplinary team, because in a hospital setting or in healthcare in general, you don't just have doctors, you have nurses, you have physiotherapists and pharmacists. And shadowing all of those members firstly helps you to decide whether you want to be a doctor or another member of that team. And it also helps you to understand how everyone's roles fit together in that little jigsaw to make up good patient care. I would then recommend volunteering. So this is a very, very young me in year 12 in that video. And when I was volunteering before med school and before applying to med school. And firstly, volunteering is really good because it shows core skills like empathy. Again, I would just say to email your local hospital, because all hospitals will have a volunteering team and most will be more than happy to accept volunteers. It also gives you lots of opportunities. So from this volunteering experience, me and the other people that I was volunteering with, we got nominated by this organization called Helpforce for the outstanding volunteering team of the year because of our fundraising that we did for the hospital. So just from volunteering, we got to have this other experience and meet new people and volunteer teams from all across the UK. So it was really, really good. And I would also recommend to read some books. So there are tons and tons of really inspiring books by really inspiring clinicians out there. And these are just some of the ones that I read before I applied to medical school. It's particularly the book in the middle, This Is Going to Hurt. You might have seen it on TV. It's been made into a series now, but that's really relevant to particularly working in the NHS, and it shows the realities of medicine. It doesn't sugarcoat anything. So I think that's a really good one to read if you want to get a realistic picture. There's also things like summer schools that you can attend. I personally didn't do one of these, but I wouldn't stress if you don't do a summer school. There are also lots of other things you can do that show your interest in topics related to medicine. So the Royal Society of Medicine has lots of free webinars and videos about topics within medicine, and also PubMed, it's a massive database of research. So if you come across a topic in school that you find interesting and you want to read a bit more about it, see how it applies in a medical setting and also what research is going on around that topic at the moment, you could have a look at these resources and see if anything piques your interest there. I'm now going to speak about the realities of med school. So I'm going to be speaking particularly about an integrated curriculum because that's what my medical school does. And a lot of the UCAT unis follow this system. So rather than your traditional preclinical, clinical, you have a more integrated approach. So you get earlier clinical exposure and in the hospital settings and GPs, and also speaking to patients from earlier on in your course. So just to illustrate that, in the early years, this is an example of a timetable that I would have had in first year for 1 week. So in the earlier years in med school, you focus a lot more on content and theory. So whether that be your physiology, your anatomy, doing dissections. But because of this integrated curriculum, we also had a little sprinkling of some clinical things and teaching us about those softer skills like communication. So for example, we had on the more theory side, we had lectures on enzymes and data analysis and some labs, and we would have dissections as well. And then for those more clinical skills, we did some role play, so learning about how to take histories from patients, what kinds of questions you would ask to help you formulate that diagnosis, and doing some basic first aid and CPR, and and seminars. So we would discuss ethics in those. So that's just an example of an early years curriculum. I would also recommend, even though the timetable looks very packed, there is still space for you to do extracurriculars. And because medicine is so intense, having an outlet outside of your studies is really, really important. So this is just an example of the Medics netball team at my university. We also have a Medics musical every year, which is really good. I watched it last week. And then you can also join societies. There's tons of societies at university. This is just an example of our surgical society, and they hold sessions where they teach you skills like suturing. You then move on to the clinical years. So this is an example of a clinical years timetable, and you can see it's a lot more flexible. So you're not blocked in every single bit of your time to be in a specific place. You just get given a specific area of the hospital that you're meant to be in, and you really get out of it what you put in. So just get involved and talk to patients, practice your skills like taking bloods, and you also have some teaching as well from consultants and other clinical educators. And this is just us on derm placement, learning how to do wound care. So it is good fun. And we also, the first time we ever learned how to do basic sutures. So the clinical years is more about consolidating all the knowledge that you learn in the early years, which is very sciencey and theory based, and being able to apply that to patients. And I think an important lesson that we learned as well in clinical years is that your patients don't read the textbook. So in the early years, you learn a very specific science, and you see a specific presentation that patients with this condition will have these symptoms. But in reality, it doesn't always present like that. And I think it's something that you learn in clinical years is being able to apply that specific science that you learn and tailor it into a more realistic fit for everyday life and scenarios. And that's a really important skill that you learn. And then lastly, I just want to speak about some of the things that you can get involved in outside of your studies in med school. So you're there for a long time, and there's a massive scope of things that you can get involved in. So most medical schools in the UK offer the opportunity to intercalate. So you basically get a second degree, usually in the third year, but it depends on your med school, and you choose an area that you want to potentially do more research in and learn more about. And then there's opportunities for you to publish that research in a journal. Also, you can go to conferences and present that research. So this is me and my friends graduating from our first degree. So if you do medicine in the UK and you intercalate, then you essentially have 2 graduations. Then I went to a conference for the research that I did. So mine was in pediatrics. So I went to the pediatric conference. And then I was really lucky to be able to go to Barcelona and present my research at Europe's largest pediatric conference, and that was an amazing experience. And I just say that with anything that you do, whether that's medicine or not, opportunities really snowball into more opportunities. So just seize what you can. So for example, when I did that conference in Barcelona, I was able to network with the people there, and now I'm actually part of the faculty for that society that ran the conference. So I'm doing the social media aspect of it. So we make short educational videos for the members. So that's one that we made the other week on pain and sedation management within pediatric intensive care units. And if you told me even maybe a year ago that I'd be doing video editing in med school, I would have not believed you, because I didn't even know how to edit the most simple thing. So honestly, the scope is enormous. You can do things outside of the degree that aren't even medical related. I have friends that do podcasts and vintage clothing businesses, because medicine really teaches you a lot of skills that are applicable in lots of other fields. So yeah, that's the main message that I want to get across, and that's all I really have to touch on right now. I'm looking forward to answering all of your questions at the Q&A later, and I'll hand over to Claire now.
Thank you so much, Jade. It's really nice for our students to get a look into what uni life is like, and all of the opportunities you can have as a student, you know, to go on conferences, to grasp every chance that comes your way to learn more about your career, and also expand your career path. So yeah, very, very exciting things in the future.